We're heading into the July 4th weekend. We have planned a great little mini vacation with friends on the farm. Hope you enjoy it too. Hope you've enjoyed the pesto recipe, and this is a good weekend to play with it if you have time off. Today I'm going to address what I see as a recurrent and very serious problem, and that is management of anemia in prostate cancer patients. Now, adult males, don't lose iron because of menstruation. And so basically, an adult male will not become iron deficient from nutritional basis, period. Unless they're on some strange diet of styrofoam and ice cubes. The need of iron on a daily basis by men are more than adequately supplied by the diet. So, in general, the first thing you see if a man is anemic is you got to check everything, not just iron. If a man is iron deficient, then it's likely he's got bleeding going on, and the workup should be for why he's bleeding. This often involves something in the GI tract. Daily aspirin could do this too. So we get to the situation of hormonal therapy in prostate cancer, and testosterone drives hemoglobin production, the red pigment in your blood. In fact, one of the major side effects of too much testosterone, i.e., doping on the part of athletes, is the hemoglobin gets too high and the blood gets too thick. Well, the opposite is also clear. When you lower the testosterone, as you do during hormonal therapy, there's an anemia that develops because there's a low testosterone. Hemoglobins are commonly in the 11-12 range, but can go as low as 10 just because of testosterone deprivation. Yet I see time and again family practitioners, even medical oncologists, and particularly patients saying, "Oh, I'm anemic, I should start taking iron." And I've had a series of patients who have serious problems with iron overload. They didn't need iron, and their iron levels are at a range where it can damage their heart, cause diabetes, cause liver damage. And so it's absolutely malpractice to give iron to a prostate cancer patient unless you've documented there's iron deficiency going on. Otherwise, iron will have no favorable impact, and iron overload is a serious health problem. Additionally, the cancer needs iron more than the patient. It's going to suffer more from iron deficiency than the patient would. This gets to be a particular problem if you needed blood transfusions, because repeated blood transfusions as the red cells break down build up body iron pools. So one guy I had has been chronically anemic, taking iron and getting blood transfusions, and his ferritin level, the measure of iron overload, was 4 or 5 times the upper limit of normal. Crazy. So before someone on hormonal therapy starts any supplement, B12, folic acid, or iron, a blood level should be done to prove that there is a deficiency. You just don't go out and take B12, folic acid, or iron if you're anemic and you're a prostate cancer patient. Get the damn test done. It's crazy. What do you do for the anemia of hormonal therapy? Well, unfortunately, there isn't much. We used to use Procrit, which is erythropoietin, but now erythropoietin has a black box warning from the FDA that under certain conditions, erythropoietin can actually stimulate the cancer. Nevertheless, there are patients who have an iron deficiency severe enough to damage their health. Consider the patient who has coronary artery cholesterol deposits in the blood supply to their heart, or carotid cholesterol deposits and blood supply to their brain is impaired. Well, the anemia could become life-threatening and trigger a heart attack or stroke. And under those conditions, judicious use of Procrit, erythropoietin, in any of its forms, probably has a cost-benefit balance in favor of treatment. The risk of cancer progression may be minor compared to the risk of death from cardiovascular disease. Remember, this is a cancer that occurs in an age group where heart attack and stroke are common. And in many large clinical trials on early stage prostate cancer, cardiovascular deaths are going to match cancer deaths. So This is definitely a decision we often have to make. Enjoy your July 4th weekend.